Hello, I'm Captain Natasha Williams, a peri anesthesia nurse in the Air Force, and I currently serve in Tokyo, Japan. And I'm here to advocate for an underrepresented group in my hometown of New York State via the Supporting Access to Facilities and Exchanges Act, also known as the SAFE Act. So, when we talk about the problem, in New York State, substance abuse, mental health crisis, and hepatitis C infections are really extensive. They're all actually interconnected. The most vulnerable group we see is the homeless population, with about 69% of hospitalizations within this group being linked to opioid abuse. With this problem, there's a need for a solution that considers evidence based practice to come up with a compassionate solution. So, when we talk about exclusively hepatitis C infections in the vulnerable populations, it actually disproportionately affects communities such as the homeless with who specifically inject drugs. So, in New York, the rising rates of hepatitis C are directly tied to that lack of access, right? They don't have the clean needles that they need to practice safe injection practice. So next, when we talk about specific challenges faced by the homeless population, they're definitely at a disadvantage, right? They don't have transportation. There's just a lot of stigma around being homeless. They don't have proper support systems. And so a lot of times they just forego that medical care. And so that really exacerbates the issues that they deal with and increases their vulnerability. As far as evidence-based practice, we want to use evidence-based practice whenever we think about approaches to healthcare policy, right? We want to make sure that it's rooted in something solid and tangible. And so, specifically, research has indicated that harm reduction strategies such as clean needle exchange programs or supervised injection sites, they're actually really effective in reducing mortality associated with IV drug use. So evidence has shown a significant decrease. We've seen this in countries like Canada, where they have programs such as supervised injection sites, and it's quite successful. On the right, I also included a harm reduction model that actually gives examples of programs that actually help with harm reduction. So as you see, needle exchange is one of them, but there's also different programs such as prescriptions or methadone maintenance. So there's lots of ways that we can actually perform harm reduction in communities to help those with substance abuse disorders. So I chose the SAFE Act because it considers all of the components that come with addiction, and it considers addiction as it is a disease. So understanding those symptoms of impaired control, social problems, risky use, and drug effects really helps us to see that the solution for the behavioral and substance abuse addiction cannot just be stuck in punishment and abstinence, right? We really need to consider alternatives such as harm reduction. The SAFE Act also embraces strategies such as clean needle exchange and the supervised injection sites. And these are proven strategies to reduce the spread of infectious diseases, and they prevent death related to overdoses. And it improves access to care by connecting people with immediate life-saving medication or intervention, right? If someone is having an overdose, they have that immediate life-saving service rather than overdosing at home. Many see this as enabling or encouraging drug use within the community. However, it is about reducing the harm that many with addiction cause themselves and in turn the community with unsafe needle disposal practices and spreading infectious diseases such as Hep C. In order to assist these individuals who suffer with addiction, we need to first keep them alive, right? So in order to guide them to the recovery, first things first is keeping them alive. So next we're going to talk about the benefits for healthcare clinicians. Some key points and benefits is that 1, it aligns with their core values. It reduces the emergency room burden. It actually engages the physicians with the patients, and it connects these patients or individuals with support services that are really important towards their recovery. With the first example of the alignment with healthcare values, as providers and healthcare providers, we're constantly committing ourselves to practicing beneficence, non-maleficence, dignity, justice, autonomy, right? and all of that amongst our patients. So we do this by providing care compassionately and by using our best evidence-based practice. The SAFE Act aligns with these values of healthcare physicians. And when we look at the reduction of emergency room burden, it actually redirects the taxpayer dollar in a more controlled environment. We are actively preventing the transmissions of viruses like HIV, Hep C, and we're actively intervening in overdoses in real time. We are connecting with these victims of addiction, and we can provide resources to get them in place mentally, physically, and get them ready for the challenge that comes with breaking addiction. Patients and providers win with this policy. Another benefit is that we're connecting with these victims of addiction, right? We can provide resources to get them in a place mentally and physically ready, and we're actually connecting with them. Engaging these patients, opening communication, trusting, enhancing motivation for them to actually seek the treatment. So for those who are not convinced solely on the merit of the program, it is actually cost effective. It will save taxpayers dollars in the long run, especially by preventing expensive emergency room hospitalizations and reducing costs related to treating infectious diseases. When looking at key areas such as ER room visits or hospital admissions, loss in productivity, or even the cost to law enforcement, right, we can actually quantify the benefit of the program. The cost of saving in each category was calculated by taking the cost of each untreated addiction and multiplying it by percentages of potential savings, and that information was derived from the National Institute on Drug Abuse and the Bureau of Justice Statistics. So to recap, the biggest selling point is the cost effectiveness of this program. Untreated diseases and addiction result in, on average, a cost of $4,000 per visit in the emergency room, and we save $1,200 per visit, reducing costs by 30%. Hospital admissions related to addiction and diseases on average cost almost $20,000 per visit, and the SAFE Act could potentially save $3,000 per admission, so that cut costs by 15%. And finally, with each arrest costing almost $10,000 with savings down to $2,000, we reduce law enforcement costs by about 20%. So from $10,000 to $8,000, reducing it to 20%. The SAFE Act is the most humane approach to a very complicated problem, and we really need to prioritize the well-being of our New York citizens despite their circumstances. The potential to save up to 30% of taxpayer dollars shows that this is a great positive financial impact harm reduction can create in the state of New York. It's a challenging problem, but it can really be addressed with compassion and by being advocates for change. The SAFE Act is a crucial step towards a healthier and more equitable New York. So it really does represent a transformative approach, right? We're intertwining all these issues of substance abuse, mental health issues, and public health within New York. So if we actually embrace harm reduction rather than seeing it as an enabling tactic, we can really create a better socioeconomic system for healthcare in New York State. So I want you to imagine a New York, right, where we have access to clean needles and the supervised injection sites, where we're reducing overdose related death, and we're promoting a healthier community. The SAFE Act could really revolutionize public health, and I really personally have a tie with this, as I grew up in New York City and I would see these issues right in front of me, right on the streets, right on the train stations, especially as we talked about within that community of the homeless. So it really is time to break the cycle of addiction and offer hope to those who need it the most. So if this was truly something we could implement, I would urge anyone who could to join me in supporting the SAFE Act and advocating for its implementation. I really do believe that together we can make a difference in the community and impact those who need it the most. So thank you for listening. We really can be the change that New York needs.